In today's Health Talk, how you can protect your kids from diseases by taking care of yourself, and the 7 simple steps to cut your risk of heart disease. Dr. Alan Magaziner from the Magaziner Center for Wellness is joining us now. Thanks so much for being here.
Pleasure to be here, Lauren.
Okay, all these studies out recently about heart health, women, stress. We want to break it down for everyone, not just women. The 7 steps we need to, go through to make sure that we're heart healthy. So let's start with the obvious exercise.
Absolutely. Anywhere from an hour and a half to 2.5 hours a week is what's recommended. It can really help your cardiac function, your lung function, your muscles, and really keep you feeling vibrant and healthy once again.
We hear this all the time, BMI. What is that and why do I care?
BMI stands for Body Mass Index, and it's really a measure of your weight to your height ratio. It helps to tell how much body fat you might have and how much lean muscle mass you have. So it's really important that we keep it below 25. It's the goal.
Don't want to sound like a broken record here, but don't smoke.
Absolutely not. Get rid of those cigarettes. I had a patient in today, in fact, in my office, who's still smoking in spite of the fact that she has lung cancer. And I'm like, how can you expect to get better if you're still smoking your cigarettes?
We got to get the message out there. All right, healthy diet, and this is really interesting because you can have a really healthy diet and still have heart trouble. So it's exactly what's in your diet you have to be careful about.
Absolutely. You want to make sure you're eating maybe some good fatty fish such as salmon or cod on a regular basis, but primarily good green leafy vegetables, lots of pigmented vegetables, fresh fruit, nuts and seeds, some beans and grains, and stay away from the sweets, the fried foods, the trans fats, and the white flour.
Okay, the other things we always get when we go to the doctor, we want to check your cholesterol, your blood pressure, your blood sugar levels. These are really important.
Absolutely. You want to keep the blood pressure below 120 over 80, and also the blood sugar below 100, preferably even towards 90 or below. So we're seeing more diabetes than ever before in our society.
All right, another big topic this time of year is flu shots. There are 2 things I want to ask you about here. Flu shots for adults. The CDC is saying that only about 1/3 of Americans are actually getting them. Where do you stand on flu shots, and where do you stand on this whole idea of vaccinations for the whooping cough, since we're seeing about 6,800 children in California right now getting sick?
Actually, California and Washington, there's an outbreak right now of whooping cough. But I don't believe that we need to necessarily vaccinate all the adults in this country. I think it should be done on an individual basis. Some of the adults we see have had reactions, or they may be allergic to some of the components in the vaccinations. I think that we should do it on an individual basis, and there's no real great evidence that by vaccinating all the adults, we're going to reduce the whooping cough anyhow. So
what about the whole flu shot?
Flu shot, I once again think that if those people who have high risks, such as those with recurrent pneumonias, maybe COPD, which is emphysema, cigarette smokers, I think they should consider a flu shot. I don't believe that we should vaccinate all healthy American adults. I think we should look at preventing it by getting people to take good multivitamins, eat healthy foods, and even consider taking extra C and vitamin D during the winter months.
Which brings us to our last question. A lot of parents deal with their kids in ear infections. We know they're painful. They reach for those antibiotics.
Yes.
Is that a no-no?
Most of the time now it is. We're seeing more evidence now that antibiotics may not have that much of a better effect than just treating it conservatively with observation, pain management, pain medications, and something to bring maybe the fever down, and waiting maybe 2 or 3 or 4 days before we decide whether we really need an antibiotic. Most of the time these children will get better just with supportive care.
All right, Dr. Alan Magaziner, as always, we thank you for being with us.
It's my pleasure.